Assalamu alaikum students, this is Dr. Kashif Salim and this is my YouTube channel. In this video we are going to study how to take history in clinics. In history taking there are some prerequisites: greet the patient, introduce yourself, take consent, explain the procedure. Then first step of the history taking is biodata. In biodata we will ask the patient about his name, his father name, his date of birth, his occupation, his residency, his marital status, his date of admission to the hospital and mode of admission. There are two modes of admission, through OPD and through ER. Then the second step of history taking is presenting complaint. We will ask the patient in chronological order that what he had experienced first, and then the further symptom appears progressively. For example, he had fever for 3 days, cough for 2 days and chest pain for 1 day. Third step of history taking is history of presenting complaint, that is also called HOPC. Explain separately each complaint by following mnemonics. We can explain pain, Socrates, that is pain assessment model. Socrates demonstrate S for site, where exactly is the pain, O for onset of the pain, and C character of the pain, or for radiation of the pain, A for associated symptoms such as nausea or vomiting, T for time and duration, means how long they have had this pain, E relieving factors or exacerbating factors, S for severity. Then fourth step is past medical history. We will ask the patient about any medication he is taking and any history of chronic heart diseases, any history of kidney diseases, any history of liver diseases, any history of mental disorders, any history of hypertension or diabetes, etc. Step 5 is past surgical history. Ask about any surgical procedure he has underwent before in his life. If yes, then we will ask the patient when, where and why. Step number 6 is family history. Ask the patient about diabetes, hypertension, chronic heart diseases, congenital malformation, chronic illnesses in family. Step number 7 is drug history. Any drug he is taking to relieve his condition. Step number 8 is allergic history. Any allergy such as allergies from medicine such as penicillin allergy, dust allergies as in asthma. Step number 9 is blood transfusion history. Ask about donating or receiving history of blood. Step number 10 is personal history. In personal history we will ask about sleep, appetite, bowel habits, sanitary habits. Step number 11, we will ask about any addiction as smoking, alcohol intake, ask about any use of pan, gutka, chalia, etc. Step number 12 is socio-economic history. In socio-economic history, we will ask about water use, food intake, ventilation, earners in the family, dependents in the family, house rented or owned, numbers of people in the house, numbers of rooms in the house, etc. Then last step of history taking is systemic review. In systemic review we will take overview separately of all the system of the body one by one. If you liked my video, please subscribe my channel and share this video. Thank you. Allah Hafiz.